Cats are often considered mysterious creatures, and one of their most fascinating abilities is their talent for hiding pain. As natural-born predators, they've inherited instincts from their wild ancestors to conceal vulnerability. While this behavior was necessary for survival in the wild, it can make it difficult for pet owners to know when their cat is suffering. Cats may not always show outward signs of discomfort, but subtle changes in their behavior, habits, and appearance can signal that something is wrong. It's essential to keep a close watch on your cat's daily routine, and if you notice any unusual behaviors, it's best to err on the side of caution and consult a veterinarian. In this article, we'll cover several common signs that your cat may be experiencing pain, even if they don't seem to be outwardly showing it. 1. Changes in grooming habits. Cats are meticulous groomers, spending hours every day licking and cleaning themselves to keep their fur in top condition. If you notice a sudden change in your cat's grooming habits, it could be a sign of discomfort or illness. There are two extremes to watch for: overgrooming and undergrooming. Cats that are in pain may overgroom themselves in one specific area, often targeting a spot that hurts. For example, if your cat is dealing with joint pain, they might continuously lick at that particular spot as a form of self-soothing. Over time, this can lead to bald patches or irritated skin. On the flip side, cats that are too weak or unwell may neglect grooming altogether. If your cat's coat becomes matted, greasy, or disheveled, it could indicate that they are too uncomfortable or physically unable to groom themselves properly. This is particularly concerning in older cats, as it can be a sign of arthritis or other chronic health issues. 2. Hiding behavior. While cats are known for seeking out cozy spots to nap, excessive hiding can be a red flag. In the wild, injured or sick animals will often isolate themselves to avoid predators. Domesticated cats retain this instinct and may retreat to quiet, secluded areas when they're not feeling well. If your normally social cat suddenly starts hiding more than usual, such as spending hours under the bed, in closets, or other out-of-the-way places, it's worth paying attention to. Occasional hiding is normal, but if it becomes a frequent behavior, it could be an indication that your cat is in pain or distress. This is especially true if the hiding is accompanied by other behavioral changes, such as a lack of appetite or lethargy. 3. Purring in unusual situations. Purring is commonly associated with contentment and happiness in cats, but it can also serve other purposes. Cats may purr when they are in pain or feeling stressed, using the sound as a form of self-soothing. It's believed that purring has a therapeutic effect, possibly helping to reduce stress and promote healing by stimulating the body's natural recovery processes. If your cat is purring in situations where they would not normally do so, such as when they are hiding, curled up in an uncomfortable-looking position, or while isolated from people, it may be a sign that something is wrong. Pay attention to the context of your cat's purring, as it can sometimes be a subtle clue that they are not feeling well. 4. Sudden changes in behavior and aggression. Cats are creatures of habit, and significant changes in their behavior can be a telltale sign that something is off. One of the most noticeable shifts occurs when a typically friendly, well-behaved cat suddenly becomes aggressive or defensive. If your cat starts hissing, swiping, or biting when touched, particularly if you touch a specific area of their body, it could be because that area is causing them pain. For example, if your cat reacts aggressively when you pet them near their lower back, they may be dealing with arthritis or a spinal issue. This type of sudden aggression is a protective response, as your cat may be trying to prevent you from touching an area that hurts. If your usually calm and affectionate cat begins showing these defensive behaviors, it's worth consulting a vet to rule out any underlying medical problems. 5. Changes in appetite and drinking habits. Your cat's eating and drinking habits can provide significant insight into their health. A sudden loss of appetite can be one of the first signs that something is wrong. Cats are notoriously picky eaters, but if they stop eating altogether or eat significantly less than usual, it could be a sign of pain, gastrointestinal issues, or dental problems. In addition to changes in food consumption, watch for changes in your cat's drinking habits. Cats typically don't drink large amounts of water, but if you notice that your cat is drinking excessively or refusing water altogether, it could be a sign of an underlying health issue. Conditions such as kidney disease, diabetes, or urinary tract infections often result in increased thirst or dehydration. Any significant change in your cat's appetite or water intake should be taken seriously, especially if it persists for more than a day or two. 6. Lethargy and unusual tiredness. Cats naturally sleep a lot, up to 16 hours a day or more, but there's a difference between normal cat sleep and lethargy. If your cat seems unusually sluggish, uninterested in their usual activities, or is sleeping more than normal, it could be a sign that they're not feeling well. Lethargy is a common sign of illness or pain, and it often goes hand in hand with other symptoms like a loss of appetite or changes in mobility. If your cat stops playing, exploring, or interacting with you like they used to, or if they no longer seem interested in their favorite toys, it's time to take note. A lethargic cat may also avoid their litter box, bed, or other areas they usually enjoy. If they're not moving around as much or seem to be conserving energy, it could be because they are in pain and trying to avoid unnecessary movement. 7. Breathing with their mouth open. Cats primarily breathe through their noses, and it's not normal for them to breathe with their mouths open unless they are panting after vigorous activity or trying to cool down in hot weather. If your cat starts breathing through their mouth in other situations, it could be a sign of respiratory distress or other health issues. Conditions such as asthma, respiratory infections, or heart problems can cause difficulty breathing. If you notice that your cat's breathing is labored, fast, or noisy, or if they are holding their mouth open while breathing, it's important to seek veterinary attention as soon as possible. Cats are prone to hiding respiratory issues until they become severe, so early intervention is critical. 8. Mobility issues. Cats are natural jumpers and climbers, and most are very agile. If your cat suddenly seems to be struggling with mobility, whether it's avoiding jumping onto furniture, limping, or having trouble getting in and out of their litter box, it could be a sign of arthritis, injury, or other physical problems. Older cats, in particular, are prone to joint issues, and they may become less active as a result of pain or discomfort. Watch for signs of stiffness, limping, or any change in how your cat walks or moves. If your cat seems hesitant to move or has difficulty navigating stairs, jumping, or climbing, it's time to consult a vet. Early treatment for joint problems can help improve your cat's quality of life. 9. Frequent sneezing or runny nose. While occasional sneezing is normal for cats, frequent sneezing, a runny nose, or nasal discharge can indicate a respiratory infection, allergies, or even dental problems. Cats with respiratory infections may also have watery or itchy eyes, and you might notice them pawing at their face more often. In some cases, sneezing or nasal discharge can be a sign of a more serious condition, such as feline herpes virus or a fungal infection. 10. Excessive blinking or squinting. Your cat's eyes can tell you a lot about their health. If you notice that your cat is blinking excessively, squinting, or keeping one eye partially closed, it could be a sign of an eye infection or injury. Redness, swelling, or discharge from the eyes are also indicators that something may be wrong. Cats with eye problems may paw at their face or rub their eyes on furniture or the floor in an attempt to alleviate discomfort. Eye infections can escalate quickly if left untreated, so it's important to seek veterinary care if you notice any of these symptoms. As pet owners, it's our responsibility to ensure that our cats are healthy and happy. While cats are experts at hiding their pain, by paying attention to subtle changes in their behavior, grooming habits, and physical condition, we can catch potential health issues early and seek appropriate care. If you notice any of the warning signs mentioned above, especially if multiple symptoms occur at once, don't hesitate to reach out to your vet for advice. Early detection and intervention can make all the difference in your cat's well-being and quality of life. Thanks for watching. Remember to hit like and subscribe for more cat tips, and keep your cat happy and healthy.